Hello guys, welcome to my YouTube channel Legend Pharmacy. Yes, it is one of the very important video here. Why many students they don't know what is the fungal infection and what are the causes for this fungal infection, signs and symptoms, treatment, how to apply creams for the fungal infection, and some of the prevention is there. That too we will discuss in this video. Our main intention is to understand the fungal infection. Okay, actually what is this? How can we treat this one? How can we treat this one? And one more important is many steroids are used for the fungal infection. Is using of steroids is good for fungal infection or bad? That too we will discuss in this video. So it's going to a very important video. Watch the video until last. And one request to you all: don't take any medicine without any doctor prescription. Okay, means they may cause some of the serious side effects. Yes, let's start. First, let's discuss what is this fungal infection. See, fungal infection, it is a disease which is caused by the fungus. Understand? You are observing picture here. It is a fungal infection. Some of the yeast, then molds and other type of fungus, they can cause the fungal infection. Yeast, molds, other type of the fungus. This is the simple definition of the fungal infection. You are observing here scaly pattern. See here outside, borderline scaly pattern. These all are the signs of this is a fungal infection. And one more very important, how can you identify the fungal infection in an easy way? See at the border, you are observing the thick lined circle. Okay, if the circle is present means 70% those are fungal infection. Okay, thick line border, and those border can be either means in a pimple in nature, or means minute dots are present, or only scale is present, or circles are present. Okay, on that circles you observe here at the center. Okay, at the center there is hollow, but more broader at the end. See here it is a broader, so that you can easily identify it is a fungal infection. Are you getting now what is the fungal infection? Yeah. Then signs and symptoms. Some common symptoms, some common signs are there. Usually your dermatologist he will come to conclude that it is a fungal infection by saying signs and symptoms directly. If signs and symptoms are complicated, then he will go for some of the tests. Say skin rash and skin lysins, nail bed infection, oral thrush. Okay, now you saw one image, that is also one type of the fungal infection. And one more very important here, fungal infection, eczema, psoriasis, they are little bit same. They looks like same in the physical appearance, they are same, but they are totally different. And one more point, fungal infection, it is a contagious disease, means it can spread from one person to another form. But eczema, psoriasis, they all are not contagious, they cannot be spread through one person to another person or in contact with anything. Okay, if you want video on that, sir, what is the difference between eczema, how can we treat the eczema, so what the difference between fungal infection and eczema, you can ask me in the comment section. Yes, then causes. What are the causes? See, weakened immune system, it is one of the major cause for the fungal infection. If our immune system is weak, at that time the most probably fungal infection will cause us. For that reason we have to ban here steroids. We have to not use the steroids during fungal infection. That is the one major reason. And travel to an environment with excessive fungi, that is also one cause. And travel to environment with excessive, that is one cause. Then hot and humid weather. See, watery weather, humid weather, they may cause fungal infection because of the droplets, water droplets. Not maintaining personal hygiene, it is one cause. Then sweating too much of the sweating. Excessive, we can see the sweat where in the underarm part, or in the underwears, where we wear the underwears, at the private parts, due to that strips, there will be formation of the sweat due to the pressure. And wearing unclean socks, they can also cause the fungal infection. And wearing damp clothes for an extended period of time, damp clothes, that may also cause the fungal infection. Then next, treatment. See, many topical applications are available in the market, and oral dosage form also available. Most probably this fungal infection will go in 1 or 1.5 month. Okay, but you have to treat it with the, if the fungal infection is minor, it is not throughout the body, means then we can give some of the antifungal creams and it goes away. But if the fungal infection is throughout the body, it is very complicated, then doctors will prescribe some of the antifungal drugs, antifungal tablet forms, capsule forms, some of the oral dosage forms are there. If available, doctor will prescribe that one. But most probably these fungal infections, they are treatable by the topical applications like creams, lotions, some of the ointments, it can be treated. Yes, the first our treatment let's discuss, and these all are the fungal antifungal drugs. There is no steroid mix here. See, sertaconazole, it is a brand name located with the Onabet. Okay, the MRP of this is 364 for 50 gram. Then ketoconazole, it is 2% available, KZ cream 30 gram. Then the next one is a miconazole, it is a DK gel 180 rupees for 30 gram, clotrimazole 180 rupees for 50 gram, Candid Gold in the form of brand name, you can get it. These all are the OTC brands, over the counter you can take it and you can apply. And one more very important, how to apply this one we will discuss in our next slide. How to apply, what measures you have to take, when to apply this one. Are you getting what I am telling? Yeah, these are the some important anti-fungal drugs you can use to treat your fungal infection. These are enough, but if the treatment is very complicated means, then we are giving some of the antifungal drugs. Then how to apply? See, application is very important here. Always first clean and dry the infected portion. First what you have to do, you have to clean that one, means with the help of the soap water you can clean the fungal infection, soap water, and then you have to dry, wash it, dry it. Okay, dry very completely, very clean you have to dry. Okay, with the help of the cotton you can just press on the fungal infection, don't scratch or don't rub, just press on it, just press on it, it's enough. Then apply gently from outer region to the inner with 2 cm wider from infection, don't rub the cream on infection. See, this is very important, you have to apply it 2 times a day, morning one time and at night, okay, for better results, effective result. And how to apply means, you have to come from this region 2 cm beyond the fungal infection, you have to come from here, and just what you have to take, you have to just like this way you have to make circles, it's enough. Okay, this is the pattern how to apply the fungal infection. Don't rub like this way. If you rub like this way means what happens, the fungal infection may get proceed and it can cause infected to the healthy skin also. For that reason, never rub on the fungal infection, just slightly or gently you can like massage like this way, gently, so that your infection can be covered with the cream. Okay, and you have to apply cream very light, don't apply cream very dark or hard, just apply cream very light. And before applying you have to wash your hands, after application also wash your hands, don't touch the your skin to the other parts of the healthy skin, so that they can cause the infection, because it is a contagious. Prevention, very important one, never use steroids on fungal infection. Some of the various brands of steroids are available in the market, I will show you those steroids. Okay, you should not use that fungal infection. And always you remember one point, never ever use the fungal infection means with steroids. For an example, see, you are taking some of the fungal infection creams with steroids, mixed creams, don't use that, those are waste. Okay, they will just what they will do, I told you, immune system is very important here. Using fungal infections with steroids or steroid based fungal infection creams, definitely they will thin your skin and they destroys the immunity property of your skin, and it leads to various complications of the skin, and your skin infections may be return back. Okay, for temporary it will goes, but again it will comes by using these steroids. Then don't share towel, comb, cloth with others, you have to keep all these utensils, all these your private things privately, means with you only, don't share yours with others. Bath 2 times in a day. If you are excessive sweating means bath with a lukewarm water, not with a very hot, just lukewarm water. If time allows you, you bath 2 times, at least 1 time a day is enough. Keep your skin clean and dry, particularly the folds of your skin. Okay, basically like your arm region, where foldings are there, say on your private parts, on your arm region. Okay, then on the neck part, these you have to maintain clean and dry those area. Okay, and those who are highly sweating, those who are experienced with the sweating, they can use some of the antifungal powders. Then don't touch fungal infection repeatedly. This is also one of the, we have to prevent these all things. Okay, these, if you prevent these all, if you follow these all, means definitely you will say tata to your fungal infection, bye to your fungal infection. See, be aware of these creams. I have told you some of the steroid based creams are used today in our day to day life, but see here, never ever use this type of the creams. It may cause of severe complication to the fungal infection, like Forderm. See, it contains clobetasol. I have told you, it is the steroid based. Mecanozole, it is the antifungal drug. Neomycin sulfate, it is the bacterial agent, antibacterial agent. So all antibacterial, antifungal and steroid, these mixed cream, what they will do, they will cause resistance to the body, resistance to the skin. They lost their skin epidermal layer, they lost the fighting nature. These all complications will take place. See this one, clobetagium, lobetagium, these all creams are steroid based. Never ever use steroid based creams on the fungal infection. Yeah, steroid based creams, if possible, means in we are using these all in psoriasis or in eczema to minimize the condition in some extent, where in the eczema, because their itching is there, or heavy redness is there, pain is there, irritation is there. At time we are using this steroids, but in a limited conditions, in a very short duration we are using. But for using a long term of these steroids, it may cause to severe skin complications, thinning of the skin, okay, and pimples over the skin, small blisters over the skin, and growing of the hair on the skin. These all are the side effects observed by the steroid creams on the skin. So never ever use this type of the steroid creams on the fungal infection. And one more point you remember, don't take any medicine without the help of the doctor. We have to concern with the dermatologist. If you are suffering from fungal infection, go to the dermatologist. Okay, a preferred, authenticate and good dermatologist you have to prefer. Okay, yes, these are the very important. One more point, improve your immunity by taking some of the natural supplements, by drinking a lot of water, and also with by taking some of the probiotic, pre and probiotic, that may also help for the greater extent to clear the fungal infection. Yes, these all are the prevention, how to apply treatment, causes, signs and symptoms, what is the fungal infection. We have discussed here everything. So if you like this video, subscribe our channel Legend Pharmacy, turn all the bell icon, and also share this video with your friends. Thank you.